York City Health and Hospitals created the Care Improvement Contest Initiative to support year-long performance improvement projects. The initiative integrated patient experience strategies, specifically patient communication, to improve health equity.
Marrying performance improvement and patient satisfaction, I think just makes sense. I think if you're going to improve anything in healthcare, you have to start with the patient and how they feel and how they're experiencing their care.
The health system saw slight decreases in patient satisfaction scores, so the time was right for an initiative to create friendly competition among units, celebrate units achieving the largest increase in scores, and help them share best practices and lessons learned through knowledge exchange forums.
In those scores, we were starting to see that they were just becoming numbers, and so in order to create buy-in and getting our teams to understand what the data means, we needed to create a contest so that they would be able to live in the data and make small changes so they can see improvements in our scores.
11 teams documented the current state of the inpatient experience, discussed gaps, challenges, and barriers to success, and devised and tested solutions. Projects focused on nurse leader rounding, interdisciplinary provider rounding, empathy skill building and teach-back training, complex discharge planning and post-discharge follow-up, and daily management system boards and whiteboards.
Some of the things that we did were very simple. We went back to basics, knocking on the patient's door before we entered, sitting at the patient's bedside rather than standing. You know, patient's perception is important, and when you're at the bedside but you're reaching for the doorknob or, looking out into the hallway, tells the patient, are they really listening to me? So really having a seat and giving the patient your undivided attention.
It had an impact with patient-nurse communication. We felt that, and the patients felt also, that it was more of a cohesive, like a working team, right? The nurse and the patient, we're a team.
Although the real winners in this contest were the patients, 4 teams at the system's Jacoby, Woodhull, North Central Bronx, and Metropolitan locations came out on top, improving communication scores by as much as 65%.
What we learned is that through the power and approach of performance improvement and with intentional support of care providers, that we can actually change the perception but also the actual experience of a patient receiving care at our facilities, that emotions can be focused upon, that performance improvement can be applied to anything, and that at the end of the day, we'll always remember how people make us feel.